Okay, so I think we are all aboard. So let's start. Well, first of all, welcome all. Welcome to this KnowEMS third webinar. Today will be focused on the medical organization for mass gathering events, and we'll explore key examples and strategies used to ensure health and safety at this large scales gathering. We'll do it with some expertise from the National Institute for Medical Emergencies from Portugal, KnowEMS, also with Madrid Samur from the World Health Organization and from the Société Française de Médecine de Catastrophe from France. So stay with us for the next 90 minutes. You can chat online, come aboard and get some questions if you want, no problem. All the webinar will be recorded and will be published in the future on the YouTube channel of the KnowEMS projects. So starting with a brief presentation, with a brief introduction of the KnowEMS project, we will invite Michelle and Lasser from Joniter from Germany. Michelle, good afternoon.
Thank you, Joao. Welcome, everybody. Nice to have this big amount of people here. I'm going to make it quick, I think most of you already read what KnowEMS is about, but I'm going to introduce it once more. KnowEMS is from the European Commission co-funded project, which is a successor of another project, which is No Fear. During the pandemic, it became clear that all the countries aren't connected quite properly, and so there was no network in between the EMS of the different countries. So that's the reason why we have KnowEMS now. We're having webinars on very, very different, very interesting topics, and they are free for everybody. And in the end, we're going to create an atlas where even after the project ends, you can read what we're talking about, and you can see or watch the already mentioned YouTube videos. And if you have any friends or colleagues or anybody you know who might like to join those webinars, please share it. And I'm going to give over to Joao back. Thank you.
Thank you, Michelle. So we'll start with a vision of the World Health Day 2023 in Portugal, which came abroad together with Yves Cardoso from KnowEMS. Yves.
Thank you, Joel. Good afternoon, everyone. So I will share my screen. I think you are all seeing in full screen, right?
Yes.
Okay, thank you. First of all, thank you very much for the invitation. Thank you very much for bringing these topics to the agenda. It's always a pleasure to share some information and some planning and some of our lessons identified with our colleagues. Our suggestion of agenda will be the KnowEMS presentation. For those who don't know what is KnowEMS, the World Young Days that occur in 2023, the experience about the planning, the implementation, and some lessons identified. So KnowEMS is the National Institute of Medical Emergency, is from the Ministry of Health, and have the responsibility of the national coordination of the pre-hospital response, and we usually designate it as Medical Emergency Integrated System. So this system have as partners not only KnowEMS, but also the Red Cross and the fire departments in this response of the emergencies, of the medical emergency. With this, KnowEMS has also some responsibility in the medicalization of the emergency response in the line 112, in the emergency line in Portugal, with the triage, with the transfer, the referral, and the clinical advisor uh, between the pre-hospital and the hospital capacities. Another huge responsibility is related with the advanced life support teams. Not only ambulances, but also medical vehicles, helicopters, and other special teams to respond to special situations. And with this, we have also the Portuguese emergency medical team, the only classified team from WHO as an EMT in Portugal, an EMT type 1, and INEM is also the national focal point for the EMT initiative. So, with all of this, and related with this mass gathering event, that was the public interest from the government, and for security reasons, that was not only an organization by a local agency, but also as a collaboration between the entity that was responsible for the organization and the other agencies from the government. And I'm talking about INEM, but also other important agents as the police force and the other ministries. And I will send in the last slide this information. This event was between the August 1st and to August 6th of 23. The coordination of all these events in the public side, it was related with the security, and it was by the internal system of security. So the planning starts with these law enforcement, and we start the activity in INEM in July 2022. We create in INEM a task force in September of 22, and we participate in more than 19 meetings and technical visits during 22 and 23. With all these stakeholders and with all these important partners as the government project group, the local organization committee that was the responsibility from all the organization of the event. They divided themselves in different clusters. We have a strong articulation at the time with the health cluster. It was very important for the success of this event. We also participate very strongly with the Ministry of Health in the elaboration of the health plan with the other stakeholders from the health side, for example, the public health authorities, the national labs, and even coordinated by the Ministry of Health. With all of these partners, we also have, as I already mentioned, the law enforcements, the municipalities that receive these events, our partners from the integrated medical system, and other authorities related, for example, with the aviation or the border controllers. We also participate and create a strong link between the municipality of Lisbon related to the health service that they could provide at the time to this event. And one very important area, it was also the holiness security team that we plan with them. So, in the first, we analyzed what happened in the past in these other big events related with the World Young Days, and the most similar was in Spain in 2011, and we quickly understand that we will not have the real number of pilgrims by the registration that they were making, because as the past show us, we would have more non-registered pilgrims than registered pilgrims. So even related with this, we try to understand the number that could be come to Portugal to attend this event. The other thing that was similar to the World Young Days in Madrid was the space of the events and the type of division that the organization would create in the different locals. So, all of this, we were talking about a provision of 1.5 million pilgrims expected in this event. Not only during the days of the big event, but in a week after of the big event, it will start some local events that they were designated as Dias das Dioceses, and the number of pilgrims will increase during the time until the big days of the big events with the Pope visit. So the first analysis that we made, it was the impact in the medical emergency integrated system with this huge number of people, not only in Lisbon in the last days, but also in Portugal, that they were split for different parts of the country. And we made the evaluation, and we understand that we could expect a event that could have more needs, not only related with the specific event by themselves, but also related with the national response. In the other way, we analyze the risk of the events related with the main venues of the events, because the government was responsible as the health part in the main venues of the events, and we try to understand the level of needs and the level of care that we should provide at the time in the different areas that will be able to have and to receive these main venues events. We also analyze with the security forces the hybrid trends, the strike protests, and we could not forget that we were in the summer.
Que a gente quer, principalmente quando não temos carro,
And
quando tu tens que ir ao Porto, eu tenho que ir ao outro lado.
Ivo, you are muted.
yes, sorry. For all of these, we provide 4 levels of operational response. That was a first level related with the reinforce of the integrated medical emergency system. It was made a reinforced together with our partners, with the fire brigades and with the Red Cross, and we will increase in 19.89% our response in the country. The level 2 was to reinforcement with more 6 advanced life support units during the periods of time of the big events in Lisbon, but also to have 3 days after the event and 3 days more after the big or the main events, to support not only the coming of the peregrines to Lisbon, to Santarém, and to Setúbal, 3 different districts, and also the protection when they return home, and we make available, if needed, the reinforcement of the system. So the level 3 was during the big events, during August 1st and August 6th, the reinforced in the main events venues, and the level 4 was also during these big events with the strategic reinforcement of capacities, most related with mass casualty incidents. With all of these, our main venues were related with Colina do Encontro, in one part of Lisbon city, Campo da Graça, that was another area, and we change between the first part of the week to the weekend. We change place, so it was a challenge also to change the staff and to change the care to different sites. And we also have, in the end of the main venues, we have the Passeio Marítimo de Algés, that was a private event for the volunteers with the Pope. During this time, and with the Pope visit to Fatima, we also put support in the field, as we made every year during May, during the celebrations of May. We put our operation also in Fatima, that is not near from Lisbon. So we have a split and different locations to cover with all of this capacity. For all of these events, we plan as a response and as a level of care, three different level of care. The first, aid stations and mobile teams with pellegrin support, and that was provided by the organization with health volunteers. It was nurse, doctors, other health professionals that was volunteers for the organization, and also these mobile teams with fire brigades and the Red Cross mobile teams. The referral to the advanced medical posts, and the advanced medical posts were provided by KnowEMS and the Portuguese Red Cross with advanced life support. And the last level that we provide in the main venues were the EMT capacity, our EMT type 1 fixed with X-ray. Our EMT type 1 fixed with X-ray had capacity to triage, to outpatient care, to emergency room, to clinical decision unit, to minor surgery, and to X-ray. The advanced medical posts that we planned only have the capacity to triage, emergency response, and outpatient treatment, not minor surgery capacity. They should refer to the EMTs, that kind of situations. And all of this referral was coordinated by a command post that have a specialized cell related with the medical emergency response and with the medical emergency coordination as an EMTCC inside a command post. So during the implementation, we continue the response of the daily emergencies, we support the big events, and we support His Holiness health needed and high entities response that was made by a specific unit inside KnowEMS. Some pictures and some images about the first site that we have, that was Campo da Graça. It's a space in Lisbon that have many mass gatherings during the year, but the streets and the space was with a very high occupation, as the pictures show, and it was needed to provide this command post with the EMTCC inside this command post to coordinate the emergency response related with medical emergency care. You can see here the volunteers and the response that they provide in the first contact with the pellegrins, and our partners from the Red Cross and the fire brigade, the Lisbon Fire Brigade, that provide also the first aids, the basic life support, and AAD response. Then we change day 5 and day 6 for Campo da Graça, near Expo. It's a huge place with a river in the middle, and it was divided, and we put different teams in different sectors to have a more proximally response to the pellegrims, together with the organization and with the first aid response. Here we implement two EMTs, uh, two EMTs type 1 fixed with X-ray capacity in the extreme of the place in the site, one in Loures and the other one in Lisboa. We also provide the response in Fatima with an EMT type 1, with vehicles, with motorbikes, and with this coordination in the command post for the emergency medical situations. We also provide, during all these celebrations, other supports, not only the integrated medical system, but also related with other events that were happening in Lisbon in different areas. So, with all of this, we put on the fields a strategic reinforcement of the emergency medical capacity, a reinforcement of the daily response, 124 mobile teams, 93 first aid stations with the organization, 7 tents for psychological support with also the collaboration of the organization, 17 advanced medical posts, and 4 EMTs type 1 we fixed with X-ray capacity. We put on the ground more than 500 clinical staff. We attend more than 4,000 assisted pellegrims in the main events, and we only evacuate to the hospitals 3.5% of the assisted pellegrims. As lessons learned, the lessons identified, we believe that the organization and the strong link that we create with the organization was a key for the success. Other planning, articulation, integration together with other organizations and stakeholders at different levels were very important, and very important the articulation not only with the Ministry of Health but also with the public health. The training that we also provide to the first responders, and also to have a classified EMT and an EMT response system implemented at national level. And as a last huge lesson, the psychological support in the different events. We cannot forget that the planning was very dynamic with a lot of change during the months, local schedules, the number of participants, the information flow sometimes was difficult, and all of these had impact during the events, during the preparation of the events, and high impact on the decision making. But we cannot forget that we should have flexibility and cultural awareness to adapt our response to the pellegrin's philosophy and to the event dynamic. Thank you very much. It was a pleasure to be here with all of you.
Thank you, Ivo. Ivo, let me ask you, from all these key points that you have shared, if you have to highlight 2 or 3 of them, what they will be.
Thank you, João, for the question. From my perspective, the organization and the collaboration with the different stakeholders, with the aim in the cultural awareness of the specific events, the classified EMT and the EMT response system implemented in our country, and the psychological support that we provide together with other forces during these events. And one last word to the heads of the departments that are here present for the availability of the staff to come to Lisbon during these long days of works. Thank you very much.
Thank you, Ivo. Thank you very much for your sharing your experience with all of us. We're going to hear now Daniel Munoz Rodriguez and sharing about the Madrid's expertise in large gatherings from Samur, Madrid. Daniel.
Yes, hello. And I will turn my camera on.
Okay.
And I will try. We had trouble before. I will try to share now my presentation. Hopefully you can see it, because I don't know why it's not recognizing the PowerPoint presentation. Can you see it now?
Yes.
Okay, perfect. Very good. So my name is Daniel Munoz, and I am not Paloma Mirabet, who is the person who made the presentation, and well, she needs the credit. That's why I left her name there. And I'm talking about our gay pride, the gay pride in Madrid, which is the biggest in Europe, probably, if not one of the biggest in the world. For a city like Madrid, which is, I'd say, a mid-sized city. It's not as small as London, not as big, not as small as Lisbon, not as big as London or Paris. So for us having such a big event, we will go into the figures later. It's a massive event for us. Let's say that the population of Madrid is around 3.5 million people, and we have it's not very sure, or not very clear, but estimation is that we have during the gay pride a population of around 2 million people. So this is quite an event. And mainly because all of these people are, they all gather in the city center. They're not spread all over the city. So the area where the people concentrate it's very small. So it makes it very difficult to plan escape routes and other kind of things. So we have to make a very thorough risk assessment, because we don't have much liberty of movement when with the people concentrated in such a small area. On the other hand, it's also a good thing, because we know where the people is going to be, and this is a very unique thing regarding our gay pride, and it's that pretty much every year, and it's been now for over probably 20-25 years, we're having the gay pride. The first gay pride in Madrid was in the 70s, but well, it kept growing and growing and growing before even Samur existed. So we have a lot of experience with this, and the good thing is that it doesn't move, it doesn't change very much from year to year. So as in all of you in your countries with these kind of events do, we have our risk assessment, we have our meetings with all the authorities, police, traffic management, all of them, and we assessed weather conditions, we assessed everything like any other city, any other service do in these kind of events. But the main thing here is that as this happens every year, it's not like the Job Day, which happens in a city once every 20 years, or this is happening every year. So we keep learning and learning and learning every year, and we have quite a knowledge of the event. And there are a lot of differences with this mass gathering event that not others have. Like, for example, the Job Day or any others, it has very different stages. In the small area concentrated, as I said, in Madrid city center, it's an area you can walk in an hour. I mean, it's not a big area, but we have different shows, stages, and all of them placed in different locations with their own, not prepared for this kind of events. So they will have their own characteristics, and we are adapting during the years with this knowledge, this learning that we are having every year. We are adapting and we are learning and improving the way we deal with this. And there is a very important improvement that we have done. I will talk later about how we have improved quality of service and also the quality of the life of first responders, which is a very important thing, because in all of these events, you're seeing the pictures, how many people there is. This happens during summertime or near summertime in Madrid. It's very hot. It's 40 degrees, 35 degrees Celsius, like 80, 90 Fahrenheit. And the life of first responders is not easy. We have to move within the crowd when something happens. Let's say a syncope or something happens in the middle of the crowd, so we have to get there. And life is not easy. So during the years, we have evolved to learn how to live better ourselves and how to treat patients in a better way. So, of course, we have all the risk analysis, all the prevention. We try to inform population of what they have to do, how to do it. But still, we want to do something more, because this can be done everywhere. So we have evolved from a more primitive, if you will, state where we did everything the same that we do, but with, let's say, less quality. In the beginning, we had, you will see later, some pictures of our first, we can say, semi-permanent facilities. We had some like field hospitals, which are tents made from, just aluminum bars and tarp on top. And you will see, we try, this picture is the office where we plan. And you'll see it's a room in a building. And what we try is to recreate this on the field. So this is one of the lessons we have learned, is to improve the quality of living during the event. So we don't have to be like we used to be. You see the picture next to the ambulance. That's one of the temporary hospitals that we placed. We don't call them hospitals, but places for assistance. This is a temporary building, and it's an inflatable, and we had to leave it there for the length of the event. And we realized, okay, this is not the best option, because sometimes it's inflatable, the air can escape, there's a leak, there's something, it can be punctured. So we started to evolve. And on top of these resources that you see here, we have advanced life support, basic life support, motorbikes, bicycles. We have walking teams, that those are the ones that get in the crowd. We work with the police, and we have the invaluable help of the volunteers, because without them, there is no way this could happen. We don't have enough payroll to cover this kind of event for the term that it is. It lasts for over a week, so we don't have enough resources. So volunteers play a very, very important role, and we want to make their life easier. So we started, you see here up on the right, you see some volunteers setting up one of these aluminum bars and tarp tents. But right underneath, one of the improvements that we have applied, and I think it's the way to go for this mass gathering events that last in the time. And it's to make not that semi-temporary buildings with tents, but made them more proper places, air conditioning, electricity, and that's one of the very good things that I think we have done. All in the context of creating the best quality of service overall for the patients, mainly for the patients. So you can see here this picture. This could be any hospital hallway or a building, and it's this yellow container that you see here. It's one of our improvements. It's a more definite. It's temporary, of course. It's removed after the event goes, but we have a more stable place with all the conditions to attend critical patients, as well as mild patients as well. And it's one of the biggest improvements at I think it's what differentiates SAMUR from other services that don't have this. It is so that we are trying to implement this more and more in order to give to our patients, the responders working there, better quality of life and better quality of assistance. So we do all the briefings, as I mentioned. This picture is the briefing for ourselves. It's not the briefing with the police or other authorities. This is a picture, a photo of the briefing that we do. And by the way, I'm sorry about the typo. Probably you have noticed a couple more typos on the presentation. I have to apologize about that. And this planification that we do, I wanted to share, but I can't because I will have to stop sharing this. I have one more photo that I wanted you to see, because I think it's important to see things. Someone has acquired, I'm coming back, has recently acquired 3 more containers like this to be more permanent. One is going to be a command and communications post, and 2 are intended to be for patient treatment. So we have them placed all over the event, and they're not so temporary, they're more permanent, and they provide a much better quality of assistance. This is what we do in the planification for such a big event. And well, this is just for you to see how many advanced life support and basic life support we have, how we structure everything depending on the area. And this is where we place, this is the map that we usually use in our briefings, where we place all the ambulances, the medical posts, and everything. And that's pretty much it. I'd say that what we have learned from managing with these events is not the risk assessment, which is pretty much the same thing, but the will to improve quality by making better structures or having a better infrastructure, and how we have been fine-tuning, because this is happening every year, how we fine-tune how to deal with this. And well, that's pretty much it.
Thank you, Daniel. Thank you very much. Let me just asking a simple question. On the field, what do you consider it was like a key factor for success?
I think, and I'm sorry, coming back, and I think the biggest thing for success is just what I told you, evolution. That's why I didn't get very much into detail. You, Portugal, our colleagues from KnowEMS, talk already about risk assessment. Probably Catherine will talk about risk assessment. We all do that. But evolving the way that SAMUR has been evolving, like coming from tarp tents to more proper buildings with air conditioning, proper air conditioning, with everything. I think that's the important thing, because it gives the patient a much bigger quality of assistance. Being in a proper, we have like emergency rooms spread all over the city with these buildings that we have now. So I think that's what makes the difference, evolving and learning. And it's because this event is repeating year after year after year. I don't know when there's going to be the next job day, but we know this is coming every year. So by learning, not only having infrastructure, but also we learn how people behaves in this context. We know that the main thing that we have is drug overdose. We have GHB, we have methadone. In more, the figures say that we have more drug abuse than in, I don't know, the World Championship celebration, the Football World Cup, for example. There is more drug abuse. So we learn and we prepare our response units to have more antidotes, or to be, or we dictate new ways of treatment, because we have the expertise and we know what had happened last year. So I think this learning is what makes the difference.
Thank you very much, Daniel.
Sure.
Cheers for Paloma as well. Sharing indeed is one of the key learning points and key of success. So before we gonna look for Olympic Games 2024 with Catherine, let me just a simple note that you already have in the chat room, the link for our YouTube channel and the link for our website as well, in order to follow the new KnowEMS projects on the future. So look for the preparation for the Olympic Games 2024. We have Catherine Bertrand. Hello, Catherine.
My microphone is working.
Yep.
I don't know if I am able to share the slides. I will try. Fenêtre, écran, présentation, colloque, no. Wait a little bit.
Okay.
I don't know if it is a good one. I don't know.
I think Daniel first need to stop with sharing.
Yes, indeed. Thank you. Thank you, Daniel.
Okay, so I try again
Okay.
to see.
Left corner. Yeah.
I need to go to my. Oh, okay. Okay.
Perfect.
Is it okay?
Yep.
Okay. Oh, sorry.
Now you lost it.
No, I wanted to.
On the bottom.
Because
yeah.
I see you, you know.
I know.
So I wanted to. Yes. Okay, that's right. Okay, and full screen.
There. Perfect.
Full screen. Is that okay?
And it's working.
Okay. So I'm going to speak on behalf of my colleagues, especially Benoît Vivien, who is currently at the heart of the Île-de-France operation, as well as Eric Le Carpentier. So in disaster or crisis medicine, we only do what we know how to do on a daily basis. And the French emergency system is based on daily pre-hospital interaction and interoperability between emergency services, fire brigades, and internal security forces with joint exercises. And we have done a lot of exercises. As you know, there are more than 100 medical dispatch centers linked with coordination centers of firefighters, and information exchange between SAMU is immediate in real time. We have batches of medical equipment that we can mobilize to sites, and you can see them on the bottom of this slide. So the Olympic Games represent thousands of people. The number of visitors was estimated of 13 millions and was calculated as being equivalent to the population that left Paris. The difficulty lies in the number of athletes and those accompanying them, the places and conditions in which they can be accommodated in total autonomy, including medical autonomy, and a polyclinic has been built and was dedicated to them. The challenge is also to recruit 45,000 volunteers, which has been done, and to map transportation, secure logistics required, respecting the cold chain of our food, avoiding, of course, food poisoning. And volunteers are so happy to be part of the games that their smile is the best disarming countermeasure. The first step decided with the Ministry of Health was to come up with plausible scenarios, leaving room for uncertainty. The question asked was, should the scenario be evoked only on the site or elsewhere in France, since all the police resources were concentrated in the Île-de-France? In fact, this is what happened with the destruction of the railway lines one day before the opening ceremony. We thought that attention also should be paid to the worldwide impact, with varying perceptions and possible fake news, and this also happened. In February, the Ministry of Health asked our society to list hybrid scenarios. Among these scenarios, cyber attacks represent a continuum as they are so frequent. The risk of radionuclear and chemical or the risk of terrorism attacks has led to the police and army resources being reinforced to an extent rarely seen before. No drones are permitted to fly over the site. Of course, the climatic aspect was at the forefront of the questions and unknown at that time. We thought of the heat wave, but not necessarily of the rain during the opening ceremony. The problem of communication was considered with alternatives, and the decision makers are all on systems such as WhatsApp or others. And let's not forget that all these preparations were taking place at the same time as human resources were being stretched in the hospitals, and there was also a degree of social and political destabilization. In fact, the enthusiasm is such that everyone is taking part to the Olympic Games. There is a partnership between the private and public services of the state and separate responsibilities. The Olympic Committee is responsible for the athletes and the public services responsible for the general public, as for any sporting event like Formula One Grand Prix. See the building devoted to the Olympic organization and guess the budget allocated. And key hospitals have been dedicated to receive specific attendees. all departments have a specific role and commands are known. The sites are so compartmentalized, separated, that access is strictly filtered. And for example, you may be asked to drink the liquid you have with you in front of a controller. And it is even difficult for French people to get information in advance. So I guess it will be difficult for terrorists to plan anything. Obviously, all the CVs of accredited people have been rigorously checked, and quite a few has been rejected. In France, we have already defined criteria to determine the medical resources needed in the event of a crowd gathering with a tested risk analysis and calculation process. All the sites are separated and a calculation of the risk for each one has been made. And you can see the complexity of the table enclosed in the slide. Here are some examples of calculated risk for certain sites. The main risk was for the opening ceremony on the scene over a length of 6 kilometers. And the rain was a last-minute guest. The rain and thunderstorms were particularly also disruptive for water pollution and some activities. That's it so far. So that was the opening ceremony, and we will see what will happen till next Sunday. Thank you.
Thank you very much, Catherine. Let me ask you one simple question. Once the event is still running,
Yes.
and you list some of the issues that you have on the planning, what was the huge, I would say, challenge for the planning? It was, as you told, for terrorists, or it was anything else?
Well, it was a mixture of everything, you know. Everything has been decided far in advance. Of course, the climate is a complication. The security has been reinforced like we have never seen this before. So we really don't worry a lot of about this, but we never know. And what is remarkable also is a good spirit between all services, and there is a very good coordination and cooperation. And I've never seen policemen dancing with people. I have never seen, you know, and this is really. We thought that we did not expect that it could be so nice, you know. So in fact, so far, on a medical point of view, we have problems with the daily emergency services, of course, because of human resources. But we did find extra resources for the Olympic Games. We did find a lot of volunteers. We were not sure of this. And so far, everything is working very smoothly.
And we hope that the outcomes will be the perfect they can be. So good
Till
luck.
Sunday.
Until the
Yes. Of course.
Merci, Catherine.
Pleasure.
Okay. So we're gonna go now listening to Dirk Geeks from the World Health Organization, trying to understand what's the role in mass gatherings from the WHO. Hello, Geert.
Thank you, and good afternoon, colleagues. I'm starting sharing my screen. It should be there in a moment.
Yeah.
First of all, thank you for the invitation and having WHO in this webinar. Also, thank you to the previous speakers, because I feel and I see that there's a lot of alignment on the topic, and also what I will try to explain on behalf of WHO. As by the introduction, you were speaking on connection, network, but also strategic and governance approach. And I'm happy that previous colleagues shared their experience, because it's one of the approaches we as WHO would like to maintain, or at least highlight in this presentation. Also, the colleagues from Madrid, I thought it was about improving the quality, and our colleague, the previous speaker of France, also highlighted the several domains in the health sector. My presentation will not be, let me say, a concrete example, but rather underbuilding what is happening, where WHO plays a role, and how we deal with it within the European region and more globally the EMT Secretariat. It's not coming from nothing. There is a kind of, not a kind of, there is a scientific underbuilding in it. As global, we can say the strengthening the health and the well-being in this case, and it's a good example, the Olympic Games in Paris, through sports events. But you can reflect it and you can enlarge it to the Gay Parade in Madrid, or the Youth visit in Portugal. So there are similarities which comes up. As an overall approach is the health emergency preparedness. And there was the WHO Health Assembly recently in June 24, where we highlighted a number of actions and elements of this kind of approach. In my presentation, it will not go mainly on the clinical side of it, but mainly on the organizational and the principles behind. What was also agreed was that this kind of approach is quite strongly in line with the EMT initiative and the methodology of the EMT initiative. It's all about search system, building up search capacity, where we have the daily health services in different domains, where we have the health emergency search response, and on top you see the mass casualty incidents, and then we have the specialized care teams. And it's the interaction and the collaboration, and then it comes back to the network and the connection of all these actors, where we as EMT initiatives are looking in, and we try to improve the quality and for the responders and for the patients, as been mentioned before. And we try to improve the overall approach for this kind of events. The differentiation between routine care and search preparedness. Preparedness is also one of the key words, let me say, within the overall approach, and where we as WHO try to give attention. Besides the organization, and it was mentioned, and you see it when Ivo talked in Portugal, but also Madrid and France, the time-consuming, but necessary time-consuming to the preparation, the preparedness, and the coordination. And therefore, we also, as WHO, see a role of the National Health Emergency and Operations Center integrated in the National Incident Coordination Center, because you also have firefighters, police, security. It was mentioned. But I would like to highlight here that we focus on the search capacity coordination of the EMT, together with all the actors in the health organization. The EMT model is, at least as we think, crucial, because when you see, we all know the blue book at the right, but when you see in the circle at the left, that all the elements which are retaken in the circle are also applicable on the preparation, the EMS teams, the EMTs as such, which are involved with this kind of big events. And all the elements at country level, on the preparation, on the coordination, on the training, and then furthermore to come to the inner circle, reflecting on quality, accountability, flexibility, the preparation, the trainings, everything around, also the equipment, everything around in this circle also applies on these events. There was a workshop on it in 22 already, also with the FIFA World Cup, where a number of research was done, also by the Free University of Brussels. And with these elements, we worked in the different working groups. The advantage of this is that it was scientifically underbuilt, and that's why I also said I am very happy to have the examples of the three previous speakers, because this should also be one of the key elements within the EMT model, where experience sharing and working together is crucial. And I'm also happy that therefore we are, as WHO here, invited in the KnowEMS webinar by the EU. Just to show you briefly, and you will receive the presentation, the different steps which were made in the health research on that event, and also to underline it didn't come just like that. We are on it already a couple of years. Highlights on this study were that we have a number of elements, and they also came up in the previous presentations. We have a number of elements which are crucial within this event organization and the role of the EMTs. And these elements also come back in the regular health emergency deployments. Operational capacity and capability, which comes back to search capacity and capability capacity building, HR, also legislation, the clinical training, health, welfare, and the medical recording, coordination. So you see there are a lot of, not to say similarities, within the approach of the EMT model. How we try to focus or pay attention on this specifically within the European region of WHO. And as you know, we have 53 countries, so the EU and a number of countries in addition. But also in that case, it's good to share all our Central European expertise and experiences. We have the strategy, the global strategy of WHO, where a number of elements come back where we would like to focus on, and one of them is national capacities, and the previous presentations are typical national capacities increasing for a certain event with medical staff, and also covering the different aspects of the health environment. More in detail within the European region, we developed the last couple of years a number of activities or actions which are linked or which giving execution to this strategy in practice, and which come back to the EMTs. And I think important to say is which can also relate it to the approach of these mass casualty gatherings. The governance, we have a system, and also with the national focal points, and I see a lot of familiar faces around the screen. We share this, and we do this also through KnowEMS, because we can build the system stronger. We have a number of objectives which also are linked. And I would like to highlight here also the community of practice in the second one, COP, what is also what KnowEMS do, and also within WHO, we are focusing quite strongly on this community of practice because we are colleagues together. We do a lot of efforts, we do a lot of engagements, neither in health emergencies, deployments, onset disasters, but as the examples were speaking for themselves, also in these mass gathering events. And it creates some extra benefits because during this kind of mass gathering events, we can increase the level of preparedness, increase the level of knowledge transfer, increase the level of collaboration, and that will strengthen our EMT system in the future. The basic core principles, which also applies to the mass gathering events. Now I have to, yeah. One of the elements with which we try to do it is the REACH, which is also an emergency medical teams capabilities hub. We focus on a number of elements bolstering the national health emergency response. Typical for mass gathering, neither announced, neither not announced, sudden onset, and to fortify the health system. The keywords in this slide also come back to what we try to realize is that the training system, equipment system, and also classifying national EMTs who are, as the previous speakers, responsible for these mass gathering events, through strengthening the COP, the community of practice. And as a third one, also scale up the information management, as I already said, sharing the knowledge, sharing the expertise, but also scientific research, which are the main core functions of REACH, which is based in Istanbul, but it belongs to the European WHO European region, with trainings, also advocacy, like we all do for a part today, mentorship and classification, because we will focus more and more on national EMTs, the community of practice, and then the two last ones, operational research and partnership development. As I'm happy to say that we have, with a couple of people around the screen, we are working on partnerships as WHO Collaborating Center, which once again increase the community of practice, but also increase the scientific underbuilding. Mass gathering and the community of practice in detail, it's about capacity building, it's about research, and it comes to preparedness, which will at the end increase the quality of care for all of us. One other element within the European region is that we try, and we are already, we did take some steps the last couple of months, good steps, is that we also try to catch this in one IT tool, let me say, KeyMap, an operational platform, also for mentoring, but also for conducting operations and to streamline governance. And I know also a number of people around the screen are in meantime connected or integrated in this system. Summarizing, governance, capacity building, sub-regional focus, and digitalization with REACH in this domain. This was in a nutshell, colleagues, my presentation, and always open for questions, and thank you once again for having the opportunity to be here.
Thank you very much, Geert. Let me ask you one simple question. We, in the last speakers, talk about indeed for strategic, tactical, and operational level, but at national responses. World Health Organization is about worldwide. So the thing is, should standardization should be always one of the key for success about combined responses for different countries?
I would not call it standardization as such, because there are always local, national, typical specialties. What I can say is that WHO is responsible, accountable globally for health, all the aspects. It goes from TBC, HIV, psychosocial, and in this case also emergency preparedness and reactions. So yes, we covered and we tried to come up with guidelines, principles. You can find a number of standardizations, but don't understand standardization as we are looking into having all the same kind of tent or equipment.
Yeah.
How you approach, perhaps on governance,
Protocols.
you can protocols, SOPs. Perhaps on governments you can find some standardization as such, but we don't push to do all the same, but we push to reach the quality of care for all of us. Thank you.
Thank you very much once again. So before we end this session, we're going to open a few moments for some questions that some attendees have made. And we have here 2 questions. And by the order of the speakers, I will try to get in touch first with Ivo. Ivo, you got a question here asking, is that possible to identify which injuries were the most prevalent during the World Youth Days?
Thank you, João. Thank you, Mr. Dillon, for the questions. The most common things that we attend during the World Youth Days were related with allergies, with abdominal pains, with minor trauma related with limbs injuries, some sunstrokes, some dehydration, and some anxiety, and last was related with consciousness altered state. So these were the most common situations in the most of the events. Thank you.
Thank you, Ivo. Daniel, we also have a question during your presentation. I missed it, but I think it's one time to return to it. And
Sure.
it's about the methods did you use to measure the quality, quantity, and location of your medical units. I think indeed this is a question almost for all speakers, but it was to you, Daniel.
Yeah, sure. Regarding the location, it's what we talk and we agree with the police and all the other services involved, and also, and again, going back to experience, it's what we that the experience that we get year after year, and so sometimes we have placed the tents or these field hospitals in places where we have seen that as the event evolves, they get more crowded. So our experience tell us where to place them year after year. Again, the good thing about this, about the gay pride in particular, is that it keeps repeating, and it will go on and on because every year is even bigger. So based on that experience, we analyze every year, and we decide where to place them.
Perfect. Thank you, Daniel. I think
Sure.
for now, there is no more questions. And I think we can go into closing the webinar. So our next webinar will be on the 5th September. We're going to talk about the ECPR. So stay connected with the KnowEMS projects. You can, on the chat, go for our YouTube channel. We got all there, the KnowEMS webinars. for sharing. As well, you can look now for the LinkedIn page and stay connected as well with our websites for some new details for new projects that we'll bring in. I will just ask for the speakers to be here for now. Just saying goodbye for everyone. I'm John Nunes from KnowEMS, and we hope this was a profitable webinar for everyone. Thank you once again for joining these projects. See you soon.